Leicestershire Partnership Trust heart failure specialist nurse Lizelle Bernhardt is working on a study which could help millions of people with a common but dangerous condition. LPT's in-house charity, Raising Health, has supported Lizelle to carry out a PhD. She is looking at obstructive sleep apnea, which affects around a third of people with heart failure. However, the majority of these patients are undiagnosed and not treated.
Area of research interest is a condition called obstructive sleep apnea, specifically in patients with chronic heart failure. Those individuals with a condition often have breathing pauses during their sleep, and the reason why that's important is it's associated closely with conditions like high blood pressure, stroke, other heart conditions such as heart failure, problems with their heart rhythm, motor vehicle accidents, and obviously poor sleep and quality of life.
So Lizelle, like all the other staff that we're supporting in undertaking, whether it's PhD, master's work or any other independent study, has to focus on a question that's really important to our patients in LPT. So in Lizelle's case, we're looking at her finding evidence that will support the best provision of care for people with sleep apnea who have chronic congestive heart failure. And at the moment, how to best support those individuals isn't known, and that's part of what Lizelle is finding out.
If they have sleep apnea and they're not identified and treated, especially the moderate to severe cases, they're at higher risk of hypertension, high blood pressure, stroke, other cardiovascular disease, motor vehicle accidents. I've spoken to patients. I've done a presentation for the Leicestershire Sleep Apnea Patient Association. I did a presentation on sleep apnea in heart failure and what my research is about. From a clinician perspective, I've done a poster presentation in Rome at the Nursing World Conference on my pilot survey data. I've also presented my systematic review results at the World Sleep Congress in Vancouver as a poster. When I've completed my PhD, which I hope will be the end of this year, I will continue. I envisage several more publications in peer-reviewed journals, and I'm hoping to present more of my qualitative research or interview data at national and international conferences.
Raising Health has been key to Lizelle's success in being able to undertake her PhD. It's very competitive to secure funding for nurses and allied health professionals to undertake research at a level of doctoral studies. So this is an instrumental step in helping our staff to build high-level research skills so that they can take forward embedding research into practice and actually ask questions that are really important to our own patients.
To everybody who's given any donations towards Raising Health, thank you so much, because obviously without that money, clinicians like me and other colleagues who's been supported would not have been in this position to develop these research skills, to answer those all-important research questions and clinical questions, and in the end to improve patient outcomes and quality of care and quality of life for them.